The meeting will begin in 30 seconds. If you wish to speak during the The meeting will begin in 10 seconds.
Good evening. I'd like to welcome you to the November meeting of the Pitt County Board of Health. I'd like to start out, are there any public comments tonight? No brave souls came out on a cool night to comment to us. All right, well, hearing none, we'll move on to the minutes of the previous meeting. They've been circulated in advance to the members. Are there any corrections or additions to those? Hearing none, is there a motion to approve?
So move.
Is there a second?
Second.
Any further discussion? All in favor say aye.
Aye.
Any opposed? All right, minutes are approved. Move on to fiscal report. Marcia, there she is, Marcia Hall.
We are going to talk about period 4, ending October the 31st. We had 4 budget amendments the month of October. We had 2 reductions in state programs from the original agreements that were sent in February, where we had submitted our original budgets for this fiscal year. NC Baby Love was a reduction of $551, and emergency preparedness was $1,534. We also had to reduce the budget for the Wise Woman program, which had a September end date of $3,300. We also had an increase of $944 from an insurance settlement from a car accident. So it brings our overall approved budget to $11,699,101. If you go all the way across to the right with the variance, we have a little reduction, little negative with our per member per month for the month of October. Clinic fees were down just a little, and our grants, our other columns, a little bit down, and a lot of that is timing. We have to get reimbursed after the month closes. If you take into account the Medicaid cost study, the state funding from DHHS, which is our state reimbursements for expenses from the month of October, and our county appropriations, we should have a surplus of about $409,000. Are there any questions?
Well, that's certainly a positive report. Anybody have any questions for Marcia?
All right.
We need to approve this one.
Yeah, and I'm just going to take you over
Go
to
ahead.
the grant page
Altogether.
for the end of October, and I should have updated that. The balance is around $437,000, and mainly that was just minimal operation and payroll out of the HIV PrEP program and the Triple P program.
All right, any other questions for Marcia? Is there a motion to approve the budget as presented?
So move.
Is there a second?
Second.
Any further discussion? All in favor say aye. Aye. Any opposed? All right, thank you, Marcia.
Okay, I got a little bit more for y'all
Sure,
tonight.
keep going.
Yeah, all right. I didn't want to rush y'all like I normally do. Okay, so I wanted to give you a little bit of an update for, if I can get it going, our Smile Safari. So we had Dr. Vinson to start in January, mid-January, And the end of the school year went very quick. She was getting acclimated to the position. When I was looking back on it, the month of August, Pitt County Schools starts the last week. September had a holiday and the hurricane. So the month of October showed a really good snapshot of that program that I wanted to share with y'all tonight. They were at Bundy Suggs Elementary School. 1,200 medical history consent forms went home. 199 forms were returned. 122 were ineligible, so we only seen the Medicaid students, Medicaid patients. 77 of those students had scheduled exams. 73 of the 77 were new patients, just at that one school. 3 were returning patients, and 1 was a limited exam, so a child there was seen because they were having a tooth issue. So 7 exams could not be completed, and I wanted to share with you that 4 of the students would not comply with the dentist. 2 have moved, and 1 patient couldn't be taken from class. So she does have obstacles during the day of the school day. She had 37 that had to be referred out for care. 3 were receiving treatment completed somewhere else, and the 37 did see treatment on the mobile dental unit, and 30 received completed treatment on the mobile dental unit, and they had no cavities. So that was just a quick snapshot for October for the Smile Safari. Moving on, we have 15 vacant positions at Pitt County Health Department, and they're all in various stages. Dr. Silverman may report more on that later, I'm not sure. But I need to move to, in your packet, you will see an interesting email with a lot of backup. So, I need to request from you to approve the annual write-off for delinquent and uncollectible accounts. We mentioned that at the last Board of Health meeting. The amount is $539,252. This process is reoccurring, and it happens every year in the fall. Typically, it is only accounts that have been inactive for 2 years. The bad debt was not written off in 2017, 18, or this year because we were in the beginning of Epic. We were hoping that the existing accounts found in HIS could be integrated into Epic. Epic was delayed. Epic did not go live until April of 2018, and the integration was not applicable. So, we have been working out of 2 systems since April of 2018, HIS and Epic. The HIS system is breaking. That is the official email from the state. I have not been able to pull an accounts receivable report from June of this year. The DHS, the Department of Health and Human Services, have given us notice that we will not be able to bill dental services through HIS. We've got a year, which we've been working with Epic about making an interface with Dentrix, which is the leading dental software. So, the packet in front of you was completed by the County Finance Office, and that is how they determined the $539,000. This allows us to work out of one system, adjust the books to align with Epic. The accounts in Epic that are over $50 will still go to the North Carolina Clearinghouse for debt set-off. But we have to have you to approve that write-off, the bad debt write-off.
Does anybody have any questions for Marcia on this? Well, we knew it was coming, we just didn't know how big it was going to be.
Yeah, and it's fairly big, and it's big because it's 3 years worth. And it's also, it's uncollectible, it's the work we do. And this aligns us with Epic, and with the system breaking down, we really don't have a choice. We can't pull reports, so kind of at a loss.
Commissioner Colson, any questions?
I mean, having just gotten this, and it's so big, I mean, it's a trust me. So, no, there's not enough time to really review it.
totally understand. Chris McDaniel and I and Brian Barnett were working through this, and this is a report that I send in accounts receivable every month. And when we were building Epic, it was pretty, part of the build out was that you had to report your accounts receivable.
Well, with Brian Barnett having something to do with it, I have a lot of faith in him, so
I have a
Sure,
lot of
the
faith in
numbers.
him too.
I'm sure the numbers are pretty accurate.
Yeah, and this is a 10-year, we went to HIS in 2009, and as you can see, this is the historic, all of that from, I believe it's 2010 where it starts. Yeah, 2010. So the reporting piece, we have reported AR, but they are very conservative with what, in the journal entry, and that's how they've determined the 539.
What about going forward? Do you anticipate that this will be an ongoing thing in about the same amount, or will it?
I really don't know, but I'll tell you, I've got some history here. So in 2016, it was $60,442, an average balance of $132, and that was 447 accounts. In 2015, it was $13,063 was the average balance over 206 accounts. So when I go back and look, it was only the accounts that had no activity for 2 years. So this 539 are all the accounts that are still left in HIS after 2016, of October 2016. We just have to get it off the books. So November of 2014, it was 43,543, and that was 582 accounts. October 2013, it was 26,000. February of 2009, when we went to HIS, it was $190,337. So it's been no rhyme or reason. August of 2006, it was 43,166. And I've lost sleep over this because the number was so big, but it's, the work that we do, people are not, they don't pay us, and some of them do slide, but we're not gonna stop doing the work.
One of the hopes of the electronic health record is more accuracy in billing and so forth. Now, of course, we're always
Right.
gonna have bad debt, but I guess sort of like Dr. Engelke said, are there any projections that we may do better
Right.
down the road? I know they recognize barcodes and things a lot better than the old systems.
Yeah, and the only thing that worries me on the horizon is the Medicaid reform and how that looks for us as a health department. We were told that Medicaid cost study would go away, but, after you talk to some of the companies, they say, no, it's not going away. NC Trax is going away. No, you'll have 5 of the platforms with the different. So there's a lot of unknowns right now with the whole Medicaid. But yeah, we're doing, Epic allows us to really go down and look at the charges. It gets really difficult. We've been working out some workflows. When someone comes into the health department, they may or may not tell you they have Medicaid. So we can check it right there. And then sometimes they will or will not tell you have insurance. So when they get back to the clinic, it depends on whether you have Medicaid or not Medicaid, whether we give you 340B or not 340B. So, Epic has changed our whole entire workflow. So we're still working out things.
Does anybody have any other questions? Is there a motion to approve Marcia's proposal here? Motion.
Second.
Second. Any further discussion? All in favor say aye. Aye. Any opposed? All right, thank you, Marcia.
Oh, you're welcome. Thank you.
Everything else for us? Or?
I think I'm gonna have to come back in a few months and ask for Dentrix. But I try to give you some notice before I do that.
Okay.
Thanks, y'all.
All right, thank you. There appears to be no old business on the agenda unless, does anybody have any old business to bring up? If not, we'll move on to new business, and I guess who's up first? WIC program, Robin,
Okay.
and Angie Watson.
Good evening. My name's Angie Watson. I'm the Diabetes Education Program Coordinator at the Health Department. And Robin Tant and I are doing a joint presentation, a nutrition division update or report for the board. So I'm going to speak and then she'll speak later. So the objectives of our report are to inform you, tell you a little bit about our Diabetes Awareness Month and those activities and some updates, pre-diabetes updates. Robin will be speaking about the WIC program, Women, Infants, and Children, and then we'll open the floor to any questions, of course. So I'm very excited about the month of November because it's National Diabetes Month, and I don't have diabetes myself, but I love working with clients who do have diabetes, so I get excited about these things. What I'm really excited about is our public information folks here I wanted to create a banner for National Diabetes Month, and they did, I think, a fabulous job on our banner. So we've got one displayed outside the health department and the county office building. We are having a big event this month in recognition of Diabetes Awareness Month. It's actually tomorrow, Wednesday, November the 13th, from 10 to 11:30. And our focus is on physical activity, so it's called Move Your Way to Prevent and Manage Diabetes. We'll have testimonials from some of our previous and current participants in our programs. We have an exercise physiologist who's going to come and do our talk. We'll have a recipe demo and a healthy snack, and then afterward we're going to have a fun walk around the Arboretum Trail at the Egg Center. So we're trying to really promote not just talking about activity, but having people be able to do it. We'll also have little stations set up within the program for them to do various physical activity like a cornhole board and that type of thing. An event that was already held this month, that's an annual event, is a Winning with Diabetes conference. This conference is sponsored by Vidant. We have a committee, planning committee, and I'm one of the 7 people on the planning committee, so I always have a lot of kind of input into this, and I assist the day of, so I wanted to mention this. It's a well-attended event. This was actually the 18th annual event for the community, and it's open to the public. You can see some of the things that are done are screenings, so blood sugar, blood pressure, healthy weight, and also kidney screenings. And then we do provide a lunch and some snacks, and we use those as teaching points to help people with diabetes know, these are some healthy choices, because food is very complicated. This year we had 83 in attendance, which was a good turnout. Another special event that we did this past summer were some retinal screenings. This was a new program to us, and I say we did it. We hosted retinal screenings on behalf of Prevent Blindness North Carolina. They had grant funding to provide, equipment and persons to do a retinal screen in the community free of charge. And so we had very good turnout. We were steady for like 2 hours with people, but we had a total of 40 people who were screened. And of those, almost half of them actually had some kind of suspicion in their eyes, the blood vessels of their eyes. So it's not a full eye exam, but the screening kind of, lets people know if they may be at risk, and then they're to follow up with their doctor. So we had quite a few people identified that needed to follow up. And for those that don't have insurance, they could get a voucher for a free eye exam and also a free pair of eyeglasses if they needed it. So we're really excited about that program. And we're going to actually continue. We're going to try to do that at least once a year going forward. So I wanted to give you some facts about diabetes. You may already know some of these things. Diabetes is very prevalent. Here in Pitt County, 1 in 10 people have diabetes, which is similar to the national average. So the actual rate in Pitt County is 9.7%. National average is a little higher at 9.9%. But I feel like the Pitt County numbers are a little bit skewed because of our population here from, the hospital and the university and that kind of thing. So with the surrounding counties, the 7 counties that surround, including Pitt County, that rate actually jumps to 1 1 in 8 people, or 13.3%. So we get referrals from right here in Pitt County, but also, surrounding counties as needed. Not all of the surrounding counties have a diabetes education program, so we're really trying to focus on that need. So looking at the cost of diabetes, I'm sure you've probably seen numbers similar to this, but 327, in the year 2017, there was $327 billion spent on diabetes in the U.S. that year. My little graphic there to the side says 322 billion because it's a little bit older. But 1 in 5, you can see there, based on the 322 billion, 1 in 5 healthcare dollars are spent on diabetes. So that's huge. With the cost of 327 billion, 237 of that was direct costs, and then 90 billion was indirect costs. So now I say the real cost of diabetes. So, I work face-to-face with these clients, and I have a heart for the people that I work with. So we look at, what does it cost the individual in terms of their health? Diabetes, unfortunately, is the leading cause of blindness in the U.S. And also, along with hypertension or high blood pressure, diabetes is the leading cause of kidney failure, leading to dialysis. And if you're not familiar with dialysis, it's I'll just say very, very tough. My clients that are on dialysis, it's a very limited diet. It's a lot of time spent in dialysis. It's basically, for most of them, it's 3 days a week that they can't do anything else, just dialysis and sleep. So it really affects their whole life. Continuing with the real cost of diabetes, heart disease, folks with diabetes are at twice the risk of having a heart attack or stroke, just by the fact that they have a diabetes diagnosis. Those things kind of go hand in hand. Amputations, 60% of all amputations are performed on people with diabetes. Now that is non-traumatic amputation, so obviously if there's a accident, trauma, that's a different story, but the non-traumatic at 60%. And foot ulcers are the initial event in 85% of those cases. So a lot of times, even the clients that I work with, we'll talk about the importance of daily foot checks and checking your feet, and we explain what to look for. But a lot of people don't realize that most, subsequent amputations start with just a little tiny, sore or a callus or something that gets infected and can't heal because of the blood sugars. So we really try to focus on prevention in that area, and that's one of our quality indexes that we track is are people checking their feet, are folks with diabetes checking their feet daily. And you can see there 1 in 10 people with diabetes have a foot ulcer, so that's a high prevalence. Okay, so diabetes education. So we know kind of the negative side of diabetes, and this is where diabetes education comes into play. Of those diagnosed with diabetes, less than 60% have had any kind of formal education, which is tough because diabetes is so complex. So, I meet a lot of clients, and they may be 3 years into their diabetes, and they say, well, when my doctor told me I had diabetes, they just said, don't eat anything white, and here's a meter and check your sugar, and they didn't know anything about checking their feet and, getting a regular eye exam and just what to eat and that kind of thing. So the research does show that people who have received diabetes education, they're more likely to use both primary care services and preventative services. And then I apologize for my slide there, but they're also more likely sorry, I lost my notes. They're more likely to use specialty services, like going to a podiatrist or a cardiologist, and they're also more likely to check their blood sugar on a regular basis, which checking blood sugar is key to keeping those numbers in control and preventing some of these things. Okay, so specifically for our program at the health department, these are some numbers for our past fiscal year. So we had 157 total referrals for the year, which was more than a 400% increase from the previous year, so we were excited about that. 39% of our participants who started the DSME program finished it, And there's varying data on, completion rates, but really in diabetes education, there are very low completion rates. The initial program is 10 hours of education, and it's a very low number of folks that actually see that 10 hours of education through, or come at all. We had, with our monthly diabetes support group, we had a total of 181 attendees. And now we've really started having I'll say some regulars in our diabetes support group, a core group of about 8 to 10 people. It's just a drop-in, it's open to all the community. But that support from others and just kind of relating to, I know what you're going through, or being able to share, how tough diabetes is, that really seems to help folks. As far as outreach in the community, so I'm also big on, let's try to prevent diabetes. Let's try to make people aware of, the risk factors and let them know what services are available and that type of thing. So we had almost 1,100 individuals contacted. We had 24 total events in the past year. Okay, also specific to our program, we had, of the participants that finished the program, their average decrease in A1C was 0.6%. So the A1C value represents an average blood sugar value, and that decrease of 0.6% is equal to 18 points in blood sugar. So, if their blood sugar was averaging 150, it would now be 132. And this was actually for people who had an A1C above goal, so 7.5 or over. And that's significant because statistics show that if a client with diabetes can lower their A1C by 1%, 1.0, it lowers their risk of microvascular complications by 22%. So the microvascular are the eyes, the kidneys, the feet, so some of the things that we've been talking about. Those things are preventable, and that's what I always try to bring home to my clients. We also see Pitt County employees in our program, and we've really had very good participation in the past couple of years. So total with the Pitt County employees, there's about 90 who have a diagnosis of diabetes, and our goal is to, eventually reach as many of those as we can. So in the past year, we had 25 employees enrolled in the program, so that's 28% of our 90. We have, for the employees, what's called a diabetes incentive program. So if they attend the education program, they can actually get diabetes supplies for free. So blood sugar test strips, the Lancing devices, alcohol wipes, that kind of thing. And they can also get generic diabetes medications for free. So that helps with some of the burden of diabetes. Amongst our employees, we had wonderful completion rates, I'll say. So in 2017-18, we had a total of 13 employees start the program and 10 of them finished. And in 2018-19, 11 of the 12 completed the program. So those are actually really good numbers as far as the comparison with diabetes education. I wanted to give just a little bit, so I'm biased toward our program, so I'm gonna say all the things I think are great about it, but we do client evaluations, and I wanted to share some of the comments that were on some of our evaluations. You can see there, one person said it's an awesome program, so that was encouraging. I feel that now I can talk about diabetes with other people, so, minimizing some of that stigma and just also having a support network. I'm not as scared with the diagnosis, and I feel more confident in keeping it under control. And we asked, would they recommend this program to someone else, and if so, why? And so some of the answers from that were very informative, from the diabetes diagnosis to years later. So sometimes people think if they've already had education or they've had diabetes for 20 years, they don't need to come, but anyone can benefit at any given time. You learn a lot. A small group, supportive, encouraging, it is beneficial, and it's a good method of accountability. Next, I'm going to talk a little bit about our diabetes prevention program. Any questions about the diabetes program before I move on? Okay. All right. So in diabetes prevention, the health department does have several programs in place for that. You can see with the data there, There have been cohorts in the 2017-18 year, 2018-19, and then the current year, 2019-20. They're primarily community members, but this year there was actually a group started, a diabetes prevention class, started with the Pitt County employees. So that's running concurrently with a community program. And you can see the numbers there as far as, weight loss and A1C reduction. Our current year, we just started in September, so that's only like 2 months of data with that, total weight loss. So just keeping that in mind. Okay. Before I hand it over to Rob and to talk about WIC, any questions for me? Okay, well, I'll let Rob and Tant speak.
Thank you.
Well, good evening, everyone. Okay, so before I do transition into WIC, I would like to say that we are very happy to have Angie on board. She is dedicated with diabetes. She's a full-time employee that has increased in the last couple of years. Actually, she's been with us now 1 year as of September 23rd of last year. So we're very happy to have her on board, and she's just hit the ground running. So wanted to give kudos to her. Okay, so WIC. So I will start talking about caseload first because that's really important for WIC, and our funding. So it's the major concern that we have for that. So since July 2019, we did have a caseload that was reduced from about 4,500 to about 4,300. So in the last meeting that we had, I talked about some of the reasons that decline may be happening. And we talked about transportation can be issues for some people, wait times, there can be lack of understanding, birth rate declines. There's also, after the first year, we see drop-offs maybe because of formula. Infants don't need the formula as much anymore, so we see drops at that point too. So we're always working on different ways to improve that. But there's also just the perceived health and in terms of nutrition education and what it means for that client. So we're always, again, looking for ways to improve our services, and I'm going to present some of those things to you all tonight. So in order to maintain our funding, we have to meet 97% of that goal. So 97% of the 4,309, which is 4,180. So we have to maintain that in order to maintain our current funding. So since May, and the time I talked with you all last, we have met that goal, and we have exceeded that goal in August and September. So we're really excited about that. So the next thing we'll talk about is participation. I mentioned that earlier. Caseload and participation go hand in hand. So again, during the last meeting, we talked about, some of the things that we were doing, including reminding the clients, or if clients had not picked up or we hadn't seen them in a while, then we would contact them. So we're still doing all of those things. But we do have some new things that have happened since the time I talked to you all last. We have auto dialer now, and we have one-way texting, or the state has implemented that, and we're utilizing it. So if the client comes in, we ask them if they would like to be signed up for auto dialer and one-way texting. It's their choice if they want to do that. So if they do want that service, then they will get reminders. And I am personally really excited about the texting component. People really seem to do well with texting and getting reminders that way, so I'm happy that this has happened. The other new thing is online referrals. So if a client goes to nutritionnc.com, then they can actually sign themselves up to be contacted by us at the local health department. This is for all counties, but we're specific to Pitt County now, but they can actually type in Pitt or scroll to Pitt County, and they can do their own referral, and we will contact them back. So that also takes away another barrier in the fact that if they're trying to get through the phone and they can't at that particular moment, or we haven't yet called them back, they don't have to worry about that because they are going to get a call back from us. So that helps as well. We have some improvements to the physical environment that I'm going to show you some pictures of in just a moment to make it more customer friendly. And we were actually able to do this through a grant well, not through a grant, actually, through some special funding that the state allowed us to take part in. So we actually applied for that with state WIC funds, and we got some of it. So one of the things that we did were murals. So this gives you just an idea. You really have to see this in person, but they are, it's beautiful. These photos are actually photo credits for Tabitha Farrell, who actually did the murals. But this particular one we've named it the Tree of Life. And the Tree of Life really encourages breastfeeding and is inclusive of all family and support partners. Words such as courage, love, journey, promote, growth, family, they project from the wall. So again, you can kind of see it on your photo, but you have to see this in person. It's just absolutely beautiful. It represents diversity, so different cultures, people with disabilities, and it also represents healthy things. Like, for example, you can see physical activity, you can see encounters with dad, you can see loving families, you can see pets, so different things in the pictures. But again, you really have to, nature. So there's so many things about this mural that make it very special. So the other thing that we were able to do was called, we again named it, Under the Sea. And this mural is located in our what we call our height weight room. And this is where our moms, the children, they get weighed and measured. And they also get their fingers stuck to do their hemoglobin. So sometimes it's very helpful to be able to point to the wall and say, tell me what you like about the wall, or find so-and-so on the wall. It's really helpful for the children in a very calming environment. So again, this is another thing that we did with the special funding was we have great bus ads. So if the next time you're driving and you see one of the great bus, you really can't miss it. But when you see a great bus, look and see if you see the WIC ads, because it is the largest one that they have. So again, if you look at it, you really can't miss it. But the premise is healthy food, healthy kid, and then happy mom. So we're excited about that too. And as I talked about during the last meeting that we had, we have what we call WIC Fun Days about 3 times per year. And the focuses of those interventions are for healthy foods or healthy recipes to let the people sample, physical activity, and just being able to enjoy the moment. So you can see here we have some pictures of our staff that helped a lot with this. Carol Ann Glisson and Robin Bunn on the left there for you with some decoration. And then we have a family here with dad playing with child. And then we have Dr. Silvernail, who was also involved with the fun as well. So we have lots of fun, and our staff really put a lot of time and effort into planning these events. So they did a great job. And they had actually what you really can't see too well, but the featured recipe was always going to be something that is on the WIC program using WIC foods. And they get, like I said, samples, but this was a sensational pumpkin chili, and it was sensational. I actually went home. See, he's giving it. I see Dr. Silvernail giving it thumbs up over there, and I went home and made it. So it's really a good recipe. But again, the thought behind it too is you can use these are foods that are on WIC. Some of these foods. So the other thing that we have been doing, putting a little more fun into it for our staff, are caseload challenges. So we go up incrementally each month for our caseload, and I'm very proud of our staff. And since May, we have gone, we have increased our caseload, so very happy about that. And you can kind of see some of our staff doing some things like that was the picture in the middle is doing our Apple Dapple Dipping Station Day. So coming up with some creative ideas for that, but they really seem to enjoy it. And again, they worked really hard to get that caseload up. And this is a very special surprise for you all, and you will all get invitations, and you're all invited to All Aboard, a Wic Holiday open house and special reading of The Polar Express by Dr. John Silvernail. So this will happen December the 11th from 2 to 4 p.m. We are super excited. We'll have, of course, the reading of the Polar Express. We're hoping to have live music, but if not, there will be music. Nutrition education, of course. We'll have an open house for the mural displays. Imagination Library will be there on hand to give books to children, and then also let them sign up for that program where they can get a book each month. From that program goes from birth to 5 years of age, so they can sign up and they'll get a book in the mail every day. And then we'll have some refreshments. The other thing I briefly mentioned the last time that we met was wichealth.org. So wichealth.org, this is coming more in 2020, but wichealth.org is an online nutrition education program. So what this means for our participants is that they'll be able to do, of the 4 visits that they do now, they have to come in 4 times per year in order to get their benefits, at this point at least. They would only have to come in twice for their assessments. And that's low risk, so it's not everyone, but it would be our low risk clients. But this would allow that, this would take care of some of those barriers such as transportation. They can decrease in wait time, but it also allows them to be people to be accountable in what they actually want to learn about. And they can do it at any point. It's online, so you can do it in the middle of the night, you can do it in the middle of the day, you can do it when you want to. So it's not an 8 to 5 schedule, when we're there. So again, this is coming in 2020, and when this happens, I'll certainly update you all about that. So are there any questions?
Can't wait to hear you read the book.
One of my favorite stories.
Yeah.
Sounds like a lot of good activities going on. Thank you, Robin and Angie, for your presentations tonight.
Thank you.
Okay, let's move on to Health Director's report. Dr. Silvernail.
Thank you, Dr. Ramsey. Thank you, ladies. Enjoyed your report. This is an outline that I've developed to report out to the board. If this isn't to the board's liking, I can change this format. But we'll go with this for now. General points, this morning I received an email notification of a grant award. This is the Community Linkages to Care for Overdose Prevention and Response Grant. We're not sure on the dollar amount yet. We believe it is what we requested, but did not give us a dollar amount in it, but we have been awarded that grant, and that will help support the ECIM program and its interventions in the community here. Just so that you know, I did take my vacation from October 21st to October 28th. Enjoyed some time back in the state of New York, and some lovely fall foliage and halfway decent weather for a little later in the fall up there. Last month I attended the new health director training. This was the first of 3 days in Raleigh. The next one is December. They're rotating days, so I will hit the second day of that next month, and then the third day sometime after the first of the year. I also attended the Nexplanon training here in Greenville, which is a long-acting reversible contraceptive that we insert in our clinic. So I have been trained. I have not done that on an actual patient yet. We had talked about new board member training a couple of months ago. And, yep, we'll get that, thank you. looked at the online training. We will provide that link to our new board members and would ask that you complete that by the end of December and provide your certificates to Ms. Wallace, my assistant, so that can be logged. We do need to do an annual board training, and I will complete that for you in January, at our January meeting. And we are required to do the annual review of Board of Health operating procedures, which we provided to you in your packets. And we would need and that would be an action item. We would need to approve or amend those as you all see fit. And we can, do you want to do that afterwards, Keith?
Sure, yes.
I'll finish my report. Communicable diseases, we are up and running with our influenza vaccination program. As of this past Friday, the 8th, we had given 668 influenza vaccinations through our program. I did provide letters of approval to Officers Brees and Tedderton, respectively, of Greenville PD and Farmville PD, to become certified rabies vaccinators. And I know Officer Brees is in the process of beginning that training. I'm not sure where we stand with Officer Tedderton on that yet. Our clinic services, we've reinstituted some limited walk-in clinics, and I'm told earlier this evening by Dr. Hardy, my Director of Nursing, that we have moved our pregnancy tests out from Title X to optional services. This allows us to reduce that visit from about 45 minutes to about 15 minutes so that we can turn these folks over more quickly through our office, and still allows us to refer them to needed services, be that prenatal, family planning, but takes us out from under the requirements of Title X in that setting. We're considering adding some other optional services such as smoking cessation and other examinations to that clinic services palette. Maternal child health, had the pleasure of doing my first well child exam at Pitt County Health Department last month. I've seen several children with our extended role nurses in maternal child health, but one of our ladies was out, and I picked up this exam for her in her absence. We have also submitted a competitive family planning grant proposal. We have not heard back on that one yet. In the past, that funding was just provided from the state. Some of that is now in a competitive grant program, which we had to apply for. Nutrition and WIC, you've heard my staff members talk largely about that. I think you all know I'm a train nut. That's where the Polar Express thing came from. I didn't know that Robin was going to make such a big deal out of it when I offered to do it, but happy to participate and have some fun with the kids. Health education, you've heard me talk about the PrEP grant, and I am excited about the PrEP grant because, you know, as a medical student, I watch folks die from HIV. Now I've seen where we can treat folks with HIV, and this is really a public health triumph where we're at the point where we can actually prevent HIV acquisition in some folks. We accepted that multi-county grant. We had moved one of our staff members whose funding was expiring to that grant. Unfortunately, she was offered a very attractive position and has left us, so we're seeking to hire a replacement for her. In the interim, Amy Haddam has been covering the duties while we're waiting to hire that replacement. Amy has also been collaborating with Pitt County Planning Department on Census 2020. Please complete your censuses, folks. We will be incorporating messaging across the Pitt County Health Department activities on the importance of completing the census for folks. Finance Administration, as Ms. Hall reported, this past week I signed the Medicare prepaid health plan contract. It's with the county attorney for review. So it has not gone back to them yet. It's with our county attorney office for review. We will be pursuing other agreements with the other prepaid health plans so that we can be participating providers with those plans. We're not sure what's going to happen with the Medicaid transformation timeline. At one point, Secretary Cohen was on the record as saying that if the budget was not in place by November 15th, that Medicaid transformation would be delayed. As I understand it, does not appear that the budget will be in place by this Friday, and that implementation may be delayed beyond the February date that is currently out there. Environmental health, we are still looking for a food and lodging supervisor. That position has been reposted. And my last item, last month I met with the Pitt County School Superintendent. to talk about school health issues, and we agreed that we will have an ongoing discussion regarding that. There's some things that he'd like to see happen in the schools, and we're willing to discuss that and work with him on those things. So happy to entertain questions from any of you.
Sounds like a busy month.
Busy month. Thank you very much.
Let's go back to something I overlooked here, and that was the, we need to go ahead and pass these operating procedures. It's an annual item that we have to approve. Were there any changes made from the previous, from us passing it last year? Any, Betsy, no changes?
Well, there's a word that needs a change. The second sentence, second word under name and office, it should be PLE, not PAL on principal.
All right.
Mrs. Fitzpatrick would be proud of me. She was my English teacher.
Okay, any other changes? Is there a motion to approve with that one change from Commissioner Colson?
So move.
Is there a second? Second. Any further discussion? All in favor say aye.
Aye.
Any opposed? All right. Operating procedures are approved for another year. So,
Thank you, Dr. Ramsey.
sure. Is there any other business tonight? Certainly like to encourage everyone to listen in. If you haven't gotten your flu shot, be sure and get one. It takes about 10 to 14 days for your body your immune system to respond to make protective antibodies against the strains of flu that are in the vaccine. This year is unique in that the FDA did not approve the content of the vaccine until June. They generally approve it in February or March, but because of the severity of the last two flu seasons, they delayed, did more research, and tried to come up with a better match for us. We hope that'll be the case, but we won't know until we get into the middle of flu season. So I guess my slogan always is, some antibodies better than no antibodies, so we certainly encourage you to go ahead and get your flu shot. I see signs all over town saying that flu vaccine is available, so certainly encourage you to do so. It may make the difference in a healthy person, whether or not you're stay home or have to go see your doctor. It may make a difference in someone who's older with other comorbidities, diabetes and hypertension and congestive heart failure and so forth. May make a difference whether you go to the hospital or whether you end up in an intensive care unit. So certainly encourage you to get your flu shot. So, is there any other business tonight? All right, is there a motion to adjourn?
So move.
Second? Second. All in favor say aye. Aye. All right, meeting's adjourned. Thank you very much.
Thank you.